We get to do some amazing procedures in dermatology to help people look and feel better. Today I'm going to show you some videos about mole removal, laser tattoo removal, lasering of stretch marks, sclerotherapy, so many cool things, and teach you a little bit about how these procedures work. So let's dive into the first video. So this is a mole removal. They're using a plasma pen. Now this is not my favorite way to remove a mole. Hopefully this person is numb. This can be done. Cosmetic results probably going to be pretty good. I just hope that they're sending that off for pathology because it's never a good idea to remove something and then throw it in the garbage. This is a laser of a scar. I don't know what caused this scar originally, but this is probably an erbium or a CO2 laser, and you can see it immediately tighten the skin. This is incredibly satisfying. Now, the tightness of that scar that we see at the end of this procedure is not how it's going to stay. It'll relax a little bit over time. This is probably going to take more than one treatment in order to get a great result. There'll still be a small scar, but it's clearly going to look way better than it was. We're getting rid of a great big pine tree tattoo on the upper back. This hurts because the laser, although it fires very quickly, when it hits the ink under the skin, it generates heat, and that's where the pain comes from. Now, the white color is due to the instant vaporization of the tattoo under the skin, but this is going to take more than one treatment. That white color is going to fade, there's still going to be ink left, and they got to come back probably several times to keep breaking up the ink into smaller and smaller particles so the body can absorb it. Warts are incredibly frustrating, and one of the most common ways that we treat them is liquid nitrogen. This stuff is almost 400 degrees Fahrenheit below zero. When we freeze the wart, the water freezes inside those cells, and the slow thaw is what's actually going to damage the cells and then allow the body to slough off a lot of that dead skin and hopefully generate an immune response to help the body fight off the HPV virus that causes the wart. All right, this is a mask to help remove pores, blackheads, sebaceous filaments off the skin. There's a ton of stuff coming off with this. Skin's going to be less congested, and with the right skincare, we can help these from coming back. Salicylic acid and retinol are the best products to help minimize the return of these blackheads. We've got liquid nitrogen to freeze a wart on the foot. These are so stubborn and often take multiple treatments. That long freeze and then slow thaw will actually damage the cells. But the HPV virus that causes warts is really good at hiding from the immune system. So although freezing will cause part of the wart to come off, we really need the immune system to recognize that there is a viral infection there and start to fight it off, or the wart will keep coming back. Okay, we are doing some under eye filler here. I don't like how close under the skin this is. Immediately, it looks like there's going to be nodules. Hopefully this is a very, very thin filler and it will intercalate into the tissue. Otherwise, this is going to be lumpy and bumpy under the skin. I don't love doing under eye filler with this technique. Next up, we've got some skin tag removal. They're using tweezers to help pick that up, and then what looks like a plasma pen or a little bit of cautery to just melt them away from the skin. This is going to heal really well. It'd be a little bit tender, so maybe they've got some numbing under the skin, but this is a really common problem in people who have diabetes, pre-diabetes, or a strong family history of developing skin tags. We are doing CO2 or maybe erbium laser here for acne scars. This person clearly has had a lot of acne, and this is going to help tighten that skin and then generate new collagen. It will probably take several treatments, but over time these scars are going to look better and better. This person has a very large scar across their cheek, and they're using a laser to help make small channels in that scar. These small injuries will generate new collagen. We can't really see the channels being made here. This may be an erbium laser. I'm not exactly sure of which device they're using here, but with several treatments, these scars will get better over time. You can use a silicone scar gel. I've got one on my website, and gentle massage. Those things are going to help with time. Time is your best friend with scars to help make these things look better. One of the most satisfying procedures we do in dermatology is sclerotherapy. This is an injection of a substance, probably polydocanol. It's actually a detergent. It is safe to go into those leg veins, and it strips the inner lining of the blood vessels so they collapse down and they will permanently go away. After this procedure, it's important to wear compression socks to keep those veins compressed so they're less likely to come back. And They've got a lot of leg veins here. They'll go through those on the procedure, but the cosmetic result is immediate and very satisfying. This is a laser for anti-aging. You can see it tighten the skin immediately. This is probably a CO2 laser, and just watch that skin constrict right away. This is a procedure that I perform in my clinic. I love doing it, and the results are amazing. All right, this is an erbium or maybe a CO2 laser. This is anti-aging. It's going to help generate new collagen, help with fine lines and wrinkles. The downtime is anywhere between 3 to 10 days, depending on how aggressive the settings are when we perform this procedure. This is probably not a real aggressive procedure because there's a lot of space between the dots. So the density of that treatment is one of the other things that determines the recovery time. This is dermaplaning. We do this all the time with my esthetician in the clinic, removing excess hair from the face, that vellus hair. This is totally safe to do, and if you want to do it at home, I recommend the Jill Razor Starter Kit. I'll have a link down in the video description on YouTube if that's where you're watching this, where you can pick one up, and it is safe to do at home. When you do that, your skincare is going to set better on the skin. You're just going to have a nicer glow. All right, so they are doing an ablative erbium YAG laser to treat acne scars. I actually do not like doing fully ablative lasers when it comes to acne scars because scars often get bigger as you go deeper in the skin. So if you start removing layers of the skin with a laser, you can actually get down to where the scars start to look bigger. If I'm using a laser to treat acne scars, I prefer to do a fractionated laser so it doesn't take the whole top off, but it makes small holes with spaces of normal skin between to actually build new healthy collagen at deeper levels of the skin. Now everybody does it a little differently, and hopefully this individual has a lot of good experience and sees good results with their technique. I'm just telling you the way that I like to do it. We're back here doing the same thing, ablative erbium laser for acne scars. This is going really quickly, so I don't think that they're pushing the laser to go too deep into the skin, getting some superficial resurfacing. Again, I prefer fractionated lasers when we're treating acne scars, not fully ablative. The difference, you can think of it as a fully ablative laser is removing everything at the surface. Think of it like mowing the lawn and taking the whole top off, whereas a fractionated laser is like aerating the lawn where you're taking small plugs out, you're drilling small holes and leaving normal area between. So you heal a little faster, you actually build collagen at a deeper level, and you're less likely to see those acne scars widen with treatment. All right, we are on the chin. I thought it was the nose for a second. I think we're on the chin here, and they are going after some blackheads, and we see a lot of sebaceous filaments. Those are normal accumulations of oil and dead skin cells inside your pores. It helps to transit oil from the sebaceous or the oil gland up to the skin to keep your skin moisturized, to keep your skin hydrated. And the oil actually contains some defensins, things that help to kill bacteria on the skin that would otherwise be pathogenic. They're really mashing on this. I do appreciate that they have gloves. This person needs some salicylic acid or retinol. All right, we're back just at the corner of the mouth, and there is a little deeper cystic pimple there. They're using gloves, which I appreciate, and then just kind of mashing on it. It's not coming out easily. I think they need to open it up a little bit with a needle or an 11 blade, but it is coming. They just really got to mash on it. Ooh. There we go. Got most of it out, it looks like. This person could benefit from some retinol and salicylic acid in their acne routine to not get these. All right, we've got a lot of blackheads on this individual. I'm not quite sure what area of the body that we're on. There's some clothing there at the top, but they're just mashing on it. Again, I think unroofing it a little bit with a needle or with like an 11 blade, a little razor blade, that would be helpful in this case. So they come out easier with less trauma to the skin as you're picking and squeezing. These blackheads have been there a while. You can see that they're oxidized, they're dark on the top, and the whole complement of oil there is a bit dark. All right, here we've got some blackheads on the cheek, mashing on that. These are going to come out with enough pressure, but they're causing a little inflammation on the skin. And that just kind of fell apart with the tweezers. If this person was in my clinic, I'd start them on a salicylic acid wash, get them using a retinol consistently, and I think we'd see a lot of improvement with this type of acne because there's not a ton of inflammation. I think we could address this topically. If you start to get deeper cystic lesions or more inflammation, there's other treatments that would be appropriate. We got a big blackhead right up there at the top. I hope they go after it. Wow, we're still going after the little ones. Not done with that one. Getting it out. This would be a little uncomfortable. All right, we are back on the face, working on some blackheads. There's two of them right next to each other, and they're kind of focusing on the one on the right. Just mashing on it. Picking it off with the fingers. Going after that one. That one's coming out easier. Again, unroofing these. Using a needle would be very helpful. Kind of plucking that out of there. Down on the chin, lots of blackheads here for this individual. And mashing on it. That popped out easy. Popped out really easy. Pull it out with the tweezers. Well done. All right, no gloves on this one. Definitely don't like that. Just using the dirty nails. Pop. They got it. Came out pretty easy though. And just using the fingers to wipe it away. Coming down a little farther on the cheek. Pop. Got it. This is very, very mild acne. A little retinol is going to help. I would do adapalene or Differin gel. You can get that over the counter. I'll put a link down in the video description. All right, no gloves, -1 on the chin, just mashing with dirty thumbs, trying to get these blackheads out. I don't know if this is dad helping him out here or a friend. Got to wear gloves. We've got a magnified view of a pore vacuum just going over the cheek, the chin, the nose. I don't know where this is at, but you can see that suction coming out, just pulling out all these sebaceous filaments. These don't even look like blackheads. I do not recommend pore vacuums. This is not necessary at all. You can actually break capillaries, get little blood vessel formation in the skin. You can damage the skin more than you realize with these. So not dermatologist recommended. All right, guys, thank you for watching. Learned a little bit here about what to look for when you're doing lasers for acne treatment, and then just some fun pimple pops. If you've got acne, you want to use retinol and salicylic acid for this comedonal acne, which is what they were going after in most of these videos. I'll put a couple of recommendations of my favorite products down in the video description so that you can pick them up there if you want. Remember, when you purchase from the links that I provide, it helps to support my mission to provide free dermatology care to underserved populations in my community. And if you guys like these videos, I've got a lot more on the channel. You can check them out right here, and I'll see you guys on the next video.